Both of them.
Okay, in your feet. Okay. So is it in your both feet?
Yes, doctor.
Mm-hmm. Okay. Do you get the same feeling in your hands also?
Sometimes, but doctor, the feet are mostly burning.
Mm-hmm. Okay. So do you have any numbness in other parts of your body?
Yes, sometimes my toes feel cold and it gets numb.
Mm-hmm. Okay. Do you have any wounds in your feet?
No, doctor.
Okay. So do you have any rashes over that area?
No, doctor.
Mm-hmm. Mr. Rahman, may I know that are you suffering from any long-term illnesses?
Yes, doctor. I'm having this diabetes and high blood
Mm-hmm.
pressures.
Mm-hmm. Okay. So what are the drugs you are on, Mr. Rahman?
I'm taking metformin and gliclazide,
Okay. For the high blood pressure, what are you taking, Mr. Rahman?
Ramipil 5 milligram.
Okay. Mr. Rahman, may I know that how is your control? Do you follow up regularly with the doctor?
Yes, doctor. But since 1 year, I didn't go for any checkups.
Okay. How about your drug intake? Do you take these drugs regularly?
Sometimes I forget, doctor. At night when I'm sleeping, I forget to take.
Okay. So, Mr. Rahman, have you ever had low blood sugars in your past history during this time?
No, doctor.
Okay. So, Mr. Rahman, other than that, are you taking any other drugs for this?
No, doctor. Nothing else.
Mm-hmm. In your family, does anyone had any long-term illnesses like you?
Yes, doctor. My father has this same sugar levels, and mother has high blood
Mm-hmm.
pressure.
Okay. How is your father going on?
He is on insulin.
Okay. Okay, Mr. Rahman. So, may I know that what do you do for living?
Doctor, I am working as a driver these days.
Okay. How is your diet?
Doctor, diet, I'm trying to avoid, but sometimes I take from outside and sometimes sugary
Mm-hmm.
foods.
Mm-hmm. Okay. Do you have any time to do exercise?
No, doctor.
Okay. Mr. Rahman, you told me that you are a driver. Which type of vehicles you are driving?
Doctor, I'm driving the car and I also work for a delivery driver. So I take things from here and there
Okay, okay. Okay, Mr. Rahman, may I know that with whom are you living at home?
with my wife and 2 kids.
Is everything okay at home?
Yes, doctor.
Okay. May I know that, Mr. Rahman, do you ever had any chest pains?
No, doctor.
Any weakness of one side of your body?
No, doctor.
Okay. So what is your idea about this thing?
Doctor, I feel there's something nerve problem in my both feet.
Mm-hmm. Okay. So what is your main worry with that?
I just worry about losing my feet.
So Mr. Rahman, what do you expect from me?
Doctor, I just want some medication or any multivitamins.
Okay, sure. We will discuss about this, Mr. Rahman. So you are non patient with high blood sugar and high blood pressure, and you come with this bilateral, both lower limb numbness and burning sensation for about 2 to 3 months, and which is affecting in your upper limbs also. And you think it is a nerve problem and expect me to give some medicines. Is that all, or do you want me to add anything else?
No, doctor, that's all.
Is that okay if I do a quick examination with you, Mr. Rahman?
Sure, doctor.
Okay, please come to the couch, maintaining the privacy with the chaperone by my side. I will sanitize my hand and start the examination. First, I want to know your height, weight, BMI, your blood pressure, your saturation, pulse rate, and respiratory rate. I'm going to start from the head. I want to see whether you are pale and icteric, and the mouth for any cyanosis, any dental caries, and any pallor, and the neck for any lymphadenopathy, and the thyroid gland also. I want to auscultate or your heart in all four areas, and I want to please lie down, Mr. Rahman. I want to see palpate your tummy to see whether there is any organomegaly. I'm going to examine your both upper limbs, both hands and the foot. I'm going to do see the power, tone, and reflexes, especially the monofilament test in all your feet in both sides of your both foot. And I'm going to raise your foot to see whether there are any wounds around the foot. And in both hands also, I'm going to do the power, tone, reflexes, and these things. And can please get up, Mr. Rahman. I'm going to auscultate your back of the chest. And thank you.
Okay. So, vitally stable feet, warm, intact skin, no ulcers, and vibration sense reduce on great toes, and also pinprick at soles. Monofilament is reduced, also pulse is palpable.
Okay, so Mr. Rahman, considering what I gathered from your history and the examination finding, it seems that you have the complications of high sugar levels, which is called and which is calling as diabetic neuropathy. Are you aware of that, Mr. Rahman?
Yes, doctor.
Yes, so this is a condition, you know, that these high blood sugar levels are can affect all the organs in your body. So in the new, when it affects the nerves, you can feel this burning sensation and numbness of your hands and also the feet. So is that okay if I do a further investigations on you?
Sure, doctor.
Yeah, so I want to see your fasting blood sugar, HbA1c, lipid profile, your renal functions and liver functions also, and I want to see your urine albumin creatinine ratio also. So meanwhile, I will give you some advices regarding this, Mr. Rahman, as you are not taking metformin and these glycoside drugs. I want to be compliant on these drugs properly because these things are very important to maintain your sugar levels correctly in your body. And also I want to do this please be aware of having good diet to reduce the reduce the sugar levels, refined carbohydrates, increase the fresh vegetables and fruits in your diet. And is that okay with you, Mr. Rahman? Can you do that?
Okay, doctor.
Okay, so meanwhile, shall we arrange some exercises on you? So it is better if you can do some 30 minutes exercise walking per day for about 5 times per week. And meanwhile, we will arrange these. I want good to start this amitriptyline for you for this burning sensation of your feet. Do you have any allergies for any drugs?
No, doctor.
Okay, I will review you with in 2 weeks with the reports. And meanwhile, if you're having worsening of symptoms and chest pain and weakness of your body, please come to me immediately. Is that okay?
Okay, okay, doctor. Time's up. Okay.
Okay.
So your next case, Dr. Ashni, your next case is Mr. Mr. Khan, 62 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. And your time starts now.
Okay. Mr. Khan, good evening, Mr. Khan. I'm Dr. Achin, your GP today. How can I help you?
Doctor, actually, I'm getting short of breath these days.
Okay. Can you tell me more about it?
Yes, doctor, every time I'm walking for my driveway now, and it's been getting worse over the last year. And doctor, I also get coughs sometimes.
Okay, Mr. Khan, so I'm sorry about what you're going through right now. So you ever had chest pain?
Doctor, sometimes I get this chest tightness.
Mm-hmm. Okay, you told me that you have cough also. In which time of the day does the cough worsening?
Doctor, mostly when I'm walking and I'm getting breathlessness, then I get cough a lot, and all the time mostly.
Okay. How long can you walk without breathlessness?
Doctor, I walk like 200, 300 meters, then I get breathless. I don't have to sit, but
Mm-hmm.
I keep on walking and I get breathless and I don't know what's going on with me.
Mm-hmm. Okay. So do you have any swelling of your limbs?
No, doctor.
Okay. So may I know that, Mr. Khan, are you suffering from any long-term illnesses?
No, doctor.
Okay.
Only
So
high
do
blood
you?
pressure. Yes, yes, doctor. Only high blood pressures. I'm taking Ramipril for that.
Okay. How is your control with Ramipril?
It's fine. It was 130 by 80 last time I checked.
Okay. So, Mr. Khan, may I know that did you notice any weight loss with you?
Yes, doctor. I got like 3 to 4 kgs weight loss in past
Mm-hmm.
7 months.
Okay. Do you have fever also?
No, doctor.
Okay. So, other than that, do you how is your do you have any flames passing with the cough?
No, doctor.
Okay. May I know that, Mr. Khan, are you using about 2 to 3 pillows to sleep at night?
No, doctor.
Mm-hmm. Okay. So other than that, do you have any problems with urination?
No, doctor.
Any changes in your bowel habits?
No, doctor.
Any back pain?
No, doctor.
Okay. So, Mr. Khan, may I know that in your family, does anyone had this similar kind of illness?
No, doctor. Everyone is fine.
Okay. May I know about your diet, Mr. Khan?
I'm taking healthy food like balanced diet, home vegetables also.
Okay. What are you doing for a living?
Doctor, I work in a construction mine and it's a stone cutting and construction.
Okay. How long are you working in there?
Doctor, all my life I've been working there.
Okay. So, Mr. Khan, may I know that are you staying in that construction area also?
Yes, doctor. All the day
Oh,
I work there.
okay. So, with whom are you living at home?
I'm with my wife and one kid.
Mm-hmm. Okay. So, everything okay at home?
Yes, doctor.
Okay. So, Mr. Khan, do you have, can you exercise with all these symptoms?
No, doctor, I don't get time.
Yeah. Okay. Okay. Mr. Khan, so are you smoking?
Yes, doctor, I smoke like it's been 10 cigarettes for like last 20 years. 20 cigarettes for 20 years.
Okay, Mr. Khan, it's quite a high number of cigarettes. I think you're unaware of the hazards of smoking. Shall we arrange another session to decide on quitting smoking?
Okay, doctor.
How about alcohol consumption?
Doctor, no, I don't.
Okay, that's good. Okay, Mr. Khan, what is your idea now?
Doctor, I feel I have a cancer.
Mm-hmm, okay. So what is your main worry with that?
Doctor, I just don't want to die early.
Sure, sure. What do you expect from me?
Doctor, I want to know what is going on with me. Like, is it because I smoke a lot and give me any treatment
Okay.
plan?
Yeah, we will discuss about that, Mr. Khan. So you come with this breathlessness on exertion and walking, and even in sometimes in rest also for about 1 year now. And you are working in the construction site for a long time, and you are a heavy worker, and you are worried about a cancer and expect me to give some medications. Is that all, or do you want me to add anything else?
Yes, doctor, that's all.
Is that okay if I do a quick examination with you, Mr. Khan?
Sure, doctor.
Please come to the couch, Mr. Khan. I want to, with the maintaining the privacy with the chaperone, I would sanitize my hand and start the examination with you. I want to see your height, weight, BMI, blood pressure, your saturation, respiratory rate, and pulse rate. Also, I want to see whether you are pale, any icterus, any cyanosis, or any in the mouth, any cyanosis and dental caries in the neck. I want to see whether there are any lymph nodes in the cervical area and especially in the supraclavicular area. And also I want to see in your hands whether there are any tremors in your hands. And can you expose your chest, Mr. Khan? I want to see the I want to do the examination of your chest. I want to see whether there are any reduced expansion, any scars, any visible lumps. And I want to do the vocal parameters, and I want to auscultate in all three areas of both lung fields. And meanwhile I'm going to auscultate your four areas of your heart also. And then I'm going to see whether there is any pedal edema. Thank you, Mr. Khan. Can you get up? I want to do the same thing in your back also. I want to inspect, palpate, and auscultate in all six areas of your lung fields. And I want to do the peak expiratory flow rate also. Uh, Thank you.
Okay. Okay, patient is
Okay.
tachypnic at rest. Saturation 94, bilateral, fine, and inspiratory crackles, especially at the bases. Clubbing present.
Okay. Okay, yeah. So, Mr. Khan, considering what I gathered from your history and the examination finding, it reveals that you are suffering from this interstitial lung disease. Have you ever heard about it, Mr. Khan?
No, doctor.
So, I want to do some further investigations to confirm the diagnosis. Is that okay with you?
Okay, doctor.
Yes, I want to refer you for the spirometry and some blood investigations also, full blood count, CRP, ESR, and chest X-ray of you. Is that okay?
Okay, doctor.
Yeah,
Pending.
so meanwhile, yeah, we will discuss about the management, Mr. Khan. Then, what I gathered from your history and the examination findings, it doesn't seem, most probably, it doesn't seem like a cancer, but there is then some condition in your lungs which has affected your lung for a long time. There, in your case, maybe it may be due to two causes. Especially, you are working in a constructive area. Maybe the dust in that area has caused this problem, and also the smoking also has some effect. So we will arrange another session for smoking cessation, Mr. Khan. And meanwhile, I'm going to refer you to the to this occupational hazard unit to continue your to have a proper diagnosis and proper management with you. Is that okay?
Okay,
So,
doctor.
meanwhile, I'm going to refer you to the specialist about specialist in lung to for the further management of your lung condition, Mr. Khan. So, meanwhile, we will have a good diet and stop smoking. And please wear close your mask while you work at the constructive area. And I will give you some leave for this for some times until you get a better management with the specialist. Is that okay?
Okay, doctor.
Okay,
Okay.
Mr. Khan.
Okay, time's
Time's
up.
up.
9:30 seconds. Okay. So nicely done, Dr. Ashwini. There are just few points we will be discussing in this case. First was your diabetic neuropathy, right? And
Yeah.
patient was having burning and tingling at night, and now he's waking up at night because of neuropathic pain. So everything in the history was asked. One important thing was back pain in the red flags. Okay, any numbness and
Okay.
tingling sensation in legs or feet, we need to ask about the any long-term back pain. Okay, but
Mhm.
in this case,
Okay.
it was not, it was negative.
Mhm.
Okay, and one question in every diabetic neuropathy, we need to ask if a patient is walking barefoot at home, because mostly patient is walking
Mhm.
barefoot, and we have to address this at the end of the
Mhm.
management plan also. Driving
Yes.
impact, we need to know, did you ever uh, get in trouble while driving because of your this condition? Might be
Mhm.
possible he got any previous accidents and he didn't tell until you can ask. Okay, so
Mhm.
in examination everything was good. It was a kind of lengthy examination. If you don't get a lot of time there, you can just do focus. Okay, like a
Mhm.
general physical examination, then directly the legs examination.
Foot.
Okay,
Mhm.
yes, if
Mhm.
it is diabetic neuropathy. And
Mhm.
footwear at the end of the foot checkup, you will have to check
Yes.
the footwear also. Okay.
Mhm. Mhm.
Psychosocial somehow was missed in this case about smoking, alcohol.
Yes,
So
I
whenever you're
forgot.
following, yeah, sometimes it happens. So after every family history, we can ask directly about psychosocial, like
Mhm.
what do you do, and also smoking, alcohol. And
Mhm.
concern here needs to be like it's very important we address concern how we'll
Mhm.
tell the patient that as you're concerned about losing your leg, so it's very important for you to continue your medication, take them on time,
Mhm.
and if you don't take them on time, that it might be possible that you might suffer from something. You can say we will be it will be difficult for us to control them. Okay. You have to bring it
Mhm.
up in the management plan. And also
Mhm.
ask the BMI of every chronic patient. It will be
In
written
the
on the
history.
outside way. Yeah, and it will be written
Mhm.
on the outside, but you can ask when you're talking to the patient here in the
Okay.
practices. Okay, and the next
Mhm.
case was okay, so the management plan there you will be telling the patient, telling for the review of HbA1c and all the baselines and also eye checkups and
Mhm.
start the neuropathic pain. You did amitriptyline, that was perfect for at night. And also tell him about the side effects. Every time you're starting any new
Mhm.
medication, discuss about possible side
Mhm.
effects like it might cause you drowsiness or dryness of mouth. Okay,
Mhm.
and it is
Yeah.
normal. And then
Mhm.
also send him for foot care clinic,
Food check. Mhm.
yeah, to have a good footwear and avoid barefoot walking,
Mhm.
and screen for other complication like neuropathy was there, but we can ask any
Mhm.
blood and urine in early or any blurring of vision. These two should be asked
Mhm.
as a red flag in diabetes. Otherwise, safety
Mhm.
netting is if you feel there is some injury or some kind of skin changes in your feet, then please present as soon as possible.
Mhm.
Okay.
And
Second
the
was
Q risk also addressed in the same time, isn't it, Miss Dr.
yes,
Bharat? Yeah, Q
yes,
risk
yes.
I didn't have. Yeah.
You
Mhm.
forgot curious, but here we can verbalize at the end of session. We can do curious.
Mhm.
Okay, so
Okay.
second was interstitial lung disease. Basically, he was having silicosis, but here we will
Mhm.
tell occupational lung disease or interstitial lung disease. And again, sometimes patient is coming with breathlessness. You won't find any edema, anything. Here,
Mhm.
concern is very important. He said about cancer. You address very nicely at the end. It is not. It does not looks like a cancer. Okay.
Mhm.
And red flags and differentials were asked. This case was done nicely. Here we only refer the patient and also tell him about smoking cessation because it might worsen your condition. If it is not the
Mhm.
cause, but it might worsen your condition, and also connect him to the pulmonary rehabilitation. And if he
Mhm.
asks you what will happen to me to the occupational therapist, yeah, occupational respiratory center, they might give you antifibrotic therapy, okay,
Mhm. Yeah.
antifibrotic
But.
medications for your this
Mhm.
condition. And
Mhm.
also, if patient is so much hypoxic, and if he asks you like there might be some, they might give me some oxygen, then yes, home oxygen is provided in this case. if he asks you, okay?
Mhm,
Otherwise,
okay.
symptomatic management and counseling of the patient.
Yeah, okay.
So, okay, so Dr. Painumi is available.
Yes, Dr. Usara.
Okay, so your first case will be Mrs. Fatima, 26 years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is required. Just 1 minute.
Examination is required or not required?
Yes, yes, required.
Okay, okay, thank you.
1 minute.
Hello, hello, good morning. Sorry, good evening, Miss Fatima. I'm Dr. Pim. How can I help you?
Doctor, actually, I'm getting these changes in color in my hands.
Okay. May I have a look at your hand, please?
Okay, doctor, I'll pause the timer, sending the picture in group. Okay, your time
Okay.
start again.
Okay, Miss Fatima. Yes, I can see. So, can you explain more about this?
Yes, doctor, it's been going on for like now 6 months. I thought it might go away, but it's getting bigger and bigger and on my hands and now on my arms also.
Okay, okay. So it's been 6 months. So do you find these things itchy?
No, doctor.
Okay. Do you find this is increased when you are going into the going under the sunlight?
No, doctor.
Okay. So uh, what are the other medical problems you are having?
Doctor,
Like high
actually, I
sugar?
have this.
Yeah. Mm-hmm.
Yeah, I have this thyroid problem, hypothyroidism.
Okay. Yeah, okay. Okay. So are you taking any drugs for that?
Yes, doctor, I'm on levothyroxine, 2 tablets daily.
Okay. How is the control?
It's good, doctor.
Okay. So do you feel very cold still, or has
No,
it
doctor.
settled? Okay. Do you feel very thirsty?
No, doctor.
Do you find you're passing more urine than usual?
No, doctor.
Okay. How about your bowel habits? Do you notice any changes?
No, doctor. It's normal now.
Oh, okay. How about your joint? Do you have any joint pains?
No, doctor.
Mm-hmm. Do you have any chest pain?
No, doctor.
Okay. So, other than that, uh, uh, are you taking any drugs other than levothyroxine? Do you take any drugs?
No, doctor.
Okay. So, how about your family? Has anyone got similar problems in your family?
Yes, doctor, my aunt has similar white color patches on her face.
Mm-hmm. Okay. So, how is she doing now?
She's fine. She put makeup to hide them.
Okay. So, how about other medical problems in your family?
No, doctor, nothing else. Only yes, my mother has hypothyroid also.
Okay. So, Miss Fatima, may I know whether you are married or not?
Yes, doctor, I'm married. I have 1 kid.
Okay, good. So, when is your last period?
Uh, 3 weeks ago.
Okay. Are you using any birth control method?
Yes, doctor, I'm taking this COCPs.
Okay. So, what do you do for living?
Doctor, I'm an IT specialist.
Okay. So, do you smoke?
Yes, doctor, 10 cigarettes a day since 10 years now.
Okay. Have you ever considered cutting it out?
No, doctor.
Okay, we'll discuss about this. How about alcohol?
No, doctor, I don't drink.
Okay. Then, how about your diet and exercise?
I'm trying to take good diet, but doctor, sometimes now these days my weight is getting a lot high.
Okay. Okay. So, what is your idea about this condition?
Doctor, I searched on the internet. They said some skin problem.
Mm-hmm. Okay. So, what is your worries with this?
Doctor, I don't want it to spread everywhere. Like, I don't want it to go to my face also.
Okay. So, Mrs. Fatima, what do you expect from me today?
Doctor, I want to know what I can do to cure it.
Okay. So, Mrs. Fatima, let me summarize this for you first. So, you are coming with 6 months of this skin rash, and also you are having thi hypothyroidism also, and you have a family history of similar problems, and you are a little bit worried whether this will spread, and you want some management. Do you want to add anything?
No, doctor, that's all.
Okay. Is it okay if I do a quick examination?
Okay, doctor.
Okay, so in the presence of chaperone, after sanitizing my hand while maintaining privacy, I will first check your height, weight, and calculate BMI. Then I will check for fever and pallor, icterus, whether there's any hyperpigmentation in your skin. And then I will check your neck for any, if there's no any pain, I will touch and see whether there's any lumps or bumps, any anterior swelling. And then I will check your hands for any nail changes, then check blood pressure, pulse rate, saturation. And then I will check your legs for edema. Then I will closely examine these rashes. I will first see whether uh, inspect these patches, the appearance, and whether there it's shape of the this, and whether there you have any excoriation marks, and then I will touch and see whether they are whether you can feel it, whether they are uh, is there any paresthesia or anything.
Okay, doctor. On the picture, otherwise vitally stable. No excoriation, and the pictures were shared. Only this.
Okay. Okay, so Mrs. Fatima, after listening to your story and gathering all the data, it looks like you're having this condition called vitiligo. Have you ever heard about this?
No, doctor.
Okay, let me explain for you. So, Miss Fatima, what happens here is this is a collection of problems where your blood's defense mechanisms sometimes go and attack some normal cells and causes some kind of reaction. So it may can affect your thyroid gland as you are having now, and sometimes it may cause some diabetes like high blood sugar levels, and sometimes it may cause this like type of skin rashes. So, Miss Fatima, actually this is not a severe condition. I mean, these rashes are not a severe condition, but we for the management, actually you can wear sun protection. And also, as your aunt is doing, you can use this makeup to cover these areas if you find it uncomfortable. And I would like to suggest you a cream also to apply these things, a steroid cream. You can apply it in morning and night time. How does that sound?
Okay, doctor. Which
And
cream,
also,
doctor?
Miss, it's a hydrocortisone cream. 1%
Okay.
hydrocortisone cream in the morning and night. And also, Miss Fatima, I would like to discuss about your smoking. I hope you're aware about the hazards of smoking. How about if we arrange another appointment to discuss about smoking cessation?
Sure, doctor.
Okay, and about your weight, you said you are finding you are a little bit of gaining weight. So I would like to discuss with about you about the healthy lifestyle diet also. So I would like in that appointment I would like to discuss about that also, about the diet and exercises. And I want you to do some blood test, Miss Fatima. I want to review your TSH. I want to check your TSH again and want to get do a fasting blood sugar and HbA1c and a full blood count also. How does that sound?
Okay. Okay,
Okay,
doctor.
if you find any worsening of these symptoms, I want you to come and meet me. Otherwise, I will be seeing you in 1 month time with these reports.
Okay, doctor.
Okay,
Thank you,
thank you.
doctor. Time's up.
Thank you.
Just 1 minute.
Mm.
Okay. So your next case is um, Mr. James, 29 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. And your time starts now.
Hello, good afternoon, Mr. James. I'm Dr. Pumi. How can I help you?
Doctor, actually, I feel like my bowels, they are fine, but I'm just scared that I will get another diarrhea.
Okay, I'm so sorry to hear what you're going through. May I know more about this, Mr. James?
Yes, doctor, actually, since 3 years, I am diagnosed with this condition, ulcerative colitis, and I'm taking my
Okay,
medications. But
okay,
now I'm scared that I read online that it might change into cancer, doctor.
okay. So you're a little bit worried now.
Yes, doctor.
Okay, so how long you have been diagnosed now?
3 years.
Okay, at the moment, are you on any drugs?
Yes, I'm taking mesalazine and
Okay,
maintenance of mesalazine. Also, I got, doctor, one time I got admitted also.
okay. So at the moment, how is your bowel habits?
It's fine now.
Okay, so do you find any joint pains?
No, doctor.
Okay, so how about your vision? Is there any problem with your vision?
No, doctor.
Okay. So do you get any tummy pain?
No, doctor.
Okay. So Mr. James, what are the other medical problems you are suffering, like high sugar, high pressure, anything?
No, doctor. Nothing else.
Okay. So, uh, are you taking any other drugs other than the mesalazine?
No, doctor.
Mm-hmm. Okay. And Mr. James, in your family, has anyone got similar problems?
Yes, doctor. My uncle is also having same problem.
Same problem means is ulcerative colitis.
Yes, doctor.
Any serious bowel problems other than this in your family?
No, doctor. Only this.
Okay, I'm sorry, I forgot to ask. Did you notice any blood with your stools recently?
No, no, doctor.
Any weight loss?
No, doctor.
Okay, thank you. So, Mr. James, may I know what you do for living?
Doctor, I am a student.
Mm-hmm. Okay, so do you smoke?
Yes, doctor.
How much and how long?
20 cigarettes a day for 10 years now.
Mm-hmm. Have you ever considered cutting it down?
Doctor, one time I started stopping it, but
Mm-hmm.
again my bowels were getting worse. So I started
Okay.
having more cigarettes.
Mm-hmm. Okay. How about we'll discuss about this, yes? How about alcohol?
Doctor, I don't drink.
Okay. Now how about your diet?
I'm trying to take a healthy like meat and balanced diet, sometimes junk food also.
Mm-hmm. Okay. Do you exercise?
Yes, doctor. I go to
Mm-hmm.
gym
Okay, good. With whom you are living?
with my mother.
Mm-hmm. Okay. So, Mr. James, what is your idea about this apart from your scared of getting cancer? Other than that, what do you want? What your idea about this?
Doctor, otherwise I'm fine, but I'm scared. When I checked on the internet, it might change into cancer. And when will
Mm-hmm.
it happen? Like, what I have to do to stop it?
Okay, okay. So, what worries you other than this?
Doctor, I don't want to get a hospital admission and later in life. I'm taking my medications, but I don't want another admission
I know. So, what do you expect from me today?
to give me some and knowledge and leaflet and any other medication if I need.
Definitely. So, Mr. James, how this is impacting your life?
Yes, doctor.
Okay. So, Mr. James, today let me summarize. You are here to discuss about your condition, ulcerative colitis. Or you have been diagnosed for 3 years, and you are a little bit worried about the cancer risk in the future with this. And you are here to discuss about this. Do you want to add
Yes,
anything?
doctor.
Oh,
No, doctor.
okay. Okay. Thank you. So, is it okay if I do a quick examination?
Uh, okay, doctor. Okay, Dr. Bayomi, examination is not required in the case.
Okay. So, Mr. James, after gathering all the data, I want to know about your knowledge about your illness. What do you know about your illness? Have you read about it other than this cancer problem?
Yes, doctor, it's like some kind of my body problem that reacts to my
Mm-hmm.
bowels, and that's why I'm getting bleeding,
Yes,
and I
yes,
have to take
okay.
this medication whole my life.
Mm-hmm. Yes, okay. So, yes, this is actually some kind of a long-term problem in your body, in the cell level problem. So, this is yes. So, here, this ulcerative colitis, what we collectively call them as inflammatory bowel disease, also. So, Mr. James, as you have also read, yes. So ulcerative colitis has a small risk of developing into a bowel cancer or this gut cancers. That's correct. But that is a very small risk, and uh, it takes some time to develop. Not, I don't, it is like this. Not everyone with ulcerative colitis goes into a cancer. Usually, once with proper monitoring and follow up, we usually see you regularly, and we ask you every time when you're here about your new symptoms, and likewise we follow up. So with them, we can identify if there is any change in yourself that may suggest you of an early cancer. Do you understand what I tell you?
Yes, doctor.
Okay. So, Mr. James, I want to tell you something, give you some idea about how a cancer will come. Usually, when you have a cancer, you may notice some weight loss, you may notice some loss of appetite, and sometimes you may notice blood with your stools likewise. So, if you find anything like that, I want you to come and meet me. Other than that, when we find those type of things, we usually we refer you to the gut specialist who can put these cameras through your gut and see whether there is any abnormalities, and do the investigate testing accordingly. And so apart from that, Mr. James, how about we talk about some your diet and smoking also at this moment?
Sure, doctor.
Okay, so Mr. James, since you're taking cigarettes, 20 cigarettes for so many years, this is also more, is a risk factor for developing so many cancers and things. How about considering cutting it down?
Okay, doctor.
So I want to, shall we schedule another appointment to discuss about this?
Okay, doctor.
Okay. In the meantime, you said you eat so many junk foods and things. So I want you to know about the proper foods that you need to eat. If you eat too much red foods, red meats, and even processed foods, they are sometimes little bit of making you increase the risk for getting cancer sometimes. So I want you to know more about healthy diet, and I will give you this leaflet as well as I will refer you to the dietitian. And I want you to maintain proper exercises as well, and I will give you this leaflet about everything on how to maintain a good lifestyle. In the meantime, if you find any severe tummy ache, or if you again get severe diarrhea or loose stool episodes, or if you notice anything that I mentioned like weight loss, any blood with stools, I want to review you. And in the next
Okay, doctor.
visit, I want to do some blood test also. And yeah,
Okay,
thank you.
doctor. Thank you, doctor. Dr. Payami, which blood test will be done here?
Uh, I want to do a CEA and full blood count.
Okay. Yeah, yeah. Okay.
Yeah.
So nicely done, both of the cases. Let's go from the beginning first. First was your vitiligo, right?
Mhm,
So in that case, mostly patient is concerned about spreading of it into the face and things like that.
mhm,
There was nothing to address on your history taking. Everything was asked that was important. And every time we have vitiligo patient, there are few other autoimmune diseases we have to screen, like hypothyroid, you asked, diabetes mellitus 1 also. And
mhm.
anemia can be asked regarding fatigue because pernicious
Mhm.
anemia can be associated
Ah,
with that.
yes.
Okay,
Mhm,
and if there is
mhm,
hyperpigmentation, whenever there is hypopigmentation, we can ask if there is any other hyperpigmentation, like any darkening of
mhm,
the skin,
mhm,
to rule out Addison side by side,
mhm,
and the hair loss, alopecia.
mhm,
Okay, so these were
mhm,
3 to 4 diseases we can ask. Otherwise, 1 to 2 will be enough also. Um, one question in history is important about any changes in skin, like similar patches. Does it happen when you get hit? Okay, the Kobner phenomenon,
mhm,
if you remember from the
mhm,
AKT.
mhm, mhm,
If
mhm, yeah.
you are getting hit by
Mhm, mhm,
anything and it changes your skin into white patches. So we need to
mhm,
ask if you
mhm,
get hit by something, so does your skin changes color? Okay. Otherwise, there's
mhm,
nothing to add in even on the management plan, we did perfectly right. Topical potent steroids can be given. And if the disease is involving face, then most
mhm.
probably, and the pregnant woman, then we are going to refer the patient. Okay.
Okay, okay.
And importantly, as you asked about the hypothyroid symptoms, to screen for the control, everything was asked, nothing to add over here. Advised to return if it spreads speedily and on the face
Mhm,
and with the some kind of weight loss and diarrhea, then she should present.
mhm, yeah.
So next case was ulcerative colitis, but it was just a regular follow-up. Patient was concerned about cancer. This is kind of different case, but sometimes um, SP might arise questions like this. So in this case,
Mhm,
first he was telling you that he got admission. We need to ask,
yeah.
like, when was his last admission, last flare?
Mhm,
It was 9 months ago. And if he
mhm,
remembers, how was it treated? So steroids and mesalazine was given to him. Otherwise,
mhm,
we will ask how many stools he's passing, like how many times he's going to toilet. 1 to 2 formed stools per day with no blood.
mhm,
Okay.
mhm,
Otherwise, it's weight loss, extraintestinal, you ask. Here, the patient was
mhm,
having misconception about smoking. He was having more cigarettes because he thinks that it is relieving his bowel condition. So you
mhm,
address nicely at the end of management and appoint him for another. Here, one important sentence should be told to the patient: since you are smoking a lot and you already are on these medication, I'm afraid that this smoking habits is very dangerous that can cause some dangerous problem to your lungs. Okay, tell him if it's
Mm-hmm.
smoking,
Mm-hmm.
you think smoking is making your bowels better, but it can worsen your lung condition. So appoint
Mm-hmm.
another. And whatever the chronic diseases are, screen for depression.
Yeah, yeah.
Okay,
Okay.
here we can ask about low moods.
Mm. Yeah.
And in the management plan, we don't have a lot to say, but somehow a lot to say. Tell him that avoid the food that are triggering him. Special diet are not recommended in UC. Otherwise, you can
Mm-hmm.
say maintain a diary and check what triggers your bowels. Also, vaccination and regular blood tests and annual screening for other autoimmune diseases.
Mm-hmm.
Okay. And you told about how to not get another flare. You told that frequent check on the frequency and
Mm-hmm.
blood. If you find,
Mm-hmm.
then that's fine. Otherwise, one important thing we can tell to the patient is since 3 years he got the disease, we can tell after 8 to 10 years of getting this disease, we start the screening program for the cancer. So
Mm-hmm.
he doesn't have to worry about that. He's still
Ah, okay.
so early to think about the cancer.
Mm.
Okay.
Okay.
1 minute. Otherwise, you done nicely. Any
Okay.
questions?
Thank you. No.
Thank you, doctor.
Thank you, Dr. Sir.
So, Dr. Sadia, are you there?
Yes, doctor. Hi.
Your patient is Mrs. Sana, 24 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. And your
What's the
time
age?
starts now.
What's the
24.
age? Sorry.
ओके गुलावा पाणते ही हूंदे वा हाणे हिन जा ध्यानु ॿिए पासे आहिनि
Uh, other people can please mute mic.
हम तो ये लेकिन आप ही भी थोड़ा
Okay. So, Dr. Sadia, your time starts now.
Hello, Miss Sana. I'm your GP Dr. Sadia here. How can I help you today? Sorry, what was the
Doctor,
age of the
actually,
patient?
24.
Okay. Yeah.
Doctor, actually, I went for my blood test and they told me that I have low blood. They told me my hemoglobin is 9.5.
Okay. Um. All right. Can you tell me more about it? Like, what
Yes,
made you do
doctor,
the blood
since
test?
yes, actually, it was the screening test because I was getting more tired and I was breathless when I was walking up the stairs and also getting some heart racing. That's why I went for this.
Okay. Okay. And it is 9.5. You said. Am I right?
Yes, doctor.
Okay, okay. And so, do you have, other than tiredness and fatigue, do you have any shortness of breath?
Yes, doctor, when I'm climbing the stairs.
All right, okay. And any lightheadedness?
Sometimes, doctor, when I get up from the bed.
Okay, okay. And so, since when you are feeling such symptoms?
Doctor, it's been going on for like 3 months now.
Okay. And how are your periods?
Doctor, actually, I'm pregnant, 22 weeks.
Okay, all right. So, how is your pregnancy going so far?
Everything is fine, but doctor, previous test result, they told me it's 11.2 and now it's 9.5.
All right. Well, I understand your concerns. I will answer your queries. Would you mind if I ask you some questions just to gather more information about it?
Yes, doctor.
So you said you had 11 and now 9.5. Have you underwent all those pregnancy scans?
Yes,
So,
doctor. Everything, the scans are done.
okay. And are you taking any vitamins, any
Only
supplements?
folic acid.
Only
Folic
folic.
acid.
All right, okay. All right. And any pain down below?
No, doctor.
Any okay, any bleeding from down below?
No, doctor.
All right, okay. All right. Uh, Before pregnancies, did you ever had this low blood count or
No,
anemia?
doctor.
All right,
No.
okay, okay, okay. Okay. So are you having any long-term health issues?
No, doctor.
All right. Uh, okay. Any family history of any blood diseases?
No, doctor.
Okay. Um, okay. Other than this, you're not taking any other medications, am I right? Folic
Yes,
acid.
doctor.
Okay, okay.
Yes.
So, how is your home situation? Whom do you live with?
Everything is fine. I'm living with my husband.
Okay. And is this your first pregnancy?
No, doctor. It's my second.
Second, okay. And okay. And do you have enough support at home?
Yes, doctor. My husband is supportive.
Okay. And so regarding this, what are your ideas?
Doctor, I just am scared like this might harm my baby, and I feel like
Okay.
I don't have enough iron, so that's why I'm not eating a lot. That's why it is a
All right. Okay. Okay. And do you have any, how you want me to help you with it?
doctor. I want some medication, and I want to save my pregnancy.
Okay. Okay. So, Miss Sana, do you, how is your daily diet?
Doctor, I'm taking fruits and vegetables, but I don't eat meat.
Okay. All right. Okay. And, mhm. And what about how is you? Are you aware of your height and weight?
It's 24.
Okay. Um, okay. And okay. And since okay, so I will just quickly review your. You are here today with the blood reports, and your hemoglobin level is 9.5, and you are worried that your bloods are low, and you don't want any complication in the pregnancies, and for that you want me to help you with that. Am I right?
Yes, doctor.
Is there anything else you would like to add?
No, doctor.
All right. So, Miss Sana, I would like to do some physical examination on you. Is that okay with you?
Sure, doctor.
Okay. I will check your. I will check your. Uh, First of all, I will look into your vitals of a chaperone. Sterilize my hand, and I will check your vitals and blood pressure, pulse, and temperature. I will look into your eye for pallor, and also I will look into your skin, and I will check. I will examine your abdomen for the baby movement, also the fundal height and the heart rate of the baby. Is that okay with you?
Okay, doctor. Mild
Okay.
conjunctival failure. Otherwise, everything is fine.
Okay. So, Miss Sana, with from your history and examination, it seems you are having anemia. Okay. So I will do some blood investigations with you. How does it sound with you?
Sure, doctor.
All right. So what I'm going to do is I will do an iron profile test. Okay, and I will do your full iron profile. Also, will do the folate and vitamin B12. And mm, yeah,
Okay. Pending.
sorry. Okay, pending.
Pending
So
result.
yes. So, Miss Sana, your hemoglobin level is low. So the hemoglobin level, it's a part of the blood cells that carry. Hello.
Yes, yes, yes. Continue.
Yeah, so that carry oxygen in our it is a part of the blood that carry oxygen into the different part of the body, and it helps us. So because of the less iron levels, less hemoglobin level, this can lead to many complication in pregnancy. So we need to start you on iron supplements. How does it sounds to you?
Sure, doctor.
And as you can as I can as you are you're not taking any meat or anything, your diet intake is also poor. How about I'll give you some I will refer you to a dietitian, and I will also give you a leaflet about iron rich diet, and if you are vegetarian, what food will help you to increase your iron and vitamin B12. Does it is that okay with you?
Sure, doctor.
Okay. Uh, also, I will start you on iron ferrous sulfate. Okay, and also. Yeah, as I've said, I will give you some leaflet and the reading materials. You can go through them and have your dietitian. And also, I will refer you to the dietitian, and they can help you with the diet. Okay. And meantime, if you have any dizziness and shortness of breath or worsening of your symptom, you can please come back.
Okay, doctor.
Okay. And oh, you had. Yes, you had shortness of breath and also you had dizziness. So I would like to take I would like to consult with the specialist and take her input. And if needed, I might refer you to the specialist. Probably you will be needing iron infusion via your veins. How does it sounds to you?
Okay, doctor.
Okay, and if your vitamin B12 is low, they will also might put you on vitamin B supplements as well. Is that okay with you?
Okay, doctor.
Okay, and yeah, is there more time, doctor?
No, no, time is up. It's 9 minutes 30 seconds.
Okay, so if
Okay.
there is a yeah, we need to treat this.
Okay, doctor.
We need to treat this iron and low HB, because if we don't treat it, it can cause some complications in the baby and during the delivery.
Okay, doctor.
Okay, thank you.
So time's up. It's almost 10 minutes now. So next case. mm, 1 minute. Okay. So Mrs. Julia, 48 years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is great. Okay. Your time starts now.
Okay. Hello, Miss Julia. I'm your GP doctor, Sadia. How may I help you?
Doctor, actually, I have this. Uh, I'm just going 2 times a week to my toilet.
Hello.
Hello.
Yes, Miss Julia. How can I help you today?
Okay, doctor, I'm going 2 times to the toilet in a week.
All right. So does it means you pass stool twice a week?
Yes, doctor.
All right. Okay. Could you tell me a bit more about it?
Yes, doctor, it's really hard and painful for me, and it's been going on since 9 months now, and gradually it's getting worse. Now I'm just
Or
going 1 to 2 times per week, and it's painful for me also.
okay. So, Miss Julia, is it a hard stool to pass? Like, is it painful and you strain to pass, or is it less frequent?
Doctor, it's hard to pass.
Okay, and you said it, it's from 9 months and getting worse. Am I right?
Yes, doctor.
Okay. Have you noticed any blood in your stool?
No, doctor.
All right. And what is the form of the stool?
Doctor, it's really hard pellets, and I
Okay.
feel incomplete evacuation.
Oh, okay. And did you notice anything that made it like, did you, have you, as it's from 9 months, have you seen any doctor for that?
No, doctor.
Have you tried any medication?
No, doctor.
Okay. Uh, all right. And before this, how was your stool?
Doctor, before this, my stool was fine, but I just had this back pain.
Back pain. Okay, okay. And since when year is your back pain?
It's going on for like an year now since I started my job.
All right. And which part of your back does it pains?
Lower back.
Lower back. Okay. Do you have any pain that comes down in your legs?
No, doctor.
Okay. Any loss of weight?
No, doctor.
Okay. And did you notice any lump or bump anywhere in your body?
No, doctor.
Any uh, tear or down below in your back passage?
No, doctor.
Okay. Okay. And okay. Um, how is your like how is your daily diet?
Doctor, I'm trying to get a healthy diet, and but doctor, it's not going away. Even if I take fruits and fluids,
Okay. And all right. And how about fluid intake?
very little, one
Very little.
one liter in a day.
Okay. Do you smoke?
Yes, doctor. 10
Do
cigarettes
you
a day.
10? Okay. And okay. All right. And since when are you smoking?
5 years.
Okay. And have you ever thought of quitting smoking?
No, doctor.
All right. Are you aware of the hazards of smoking?
Yes, doctor.
All right. So, as it's injurious to health, I would arrange another session for smoking cessation. If and I'll give you today at the end of the consultation some smoking cessation leaflet, and you can go through it. Is that okay with you?
Sure, doctor.
All right. So, Miss, I forgot the name, Miss Julia. Miss Julia, could you tell me if you drink alcohol?
No, doctor.
All right. And do you have any long-term health issues?
No, doctor. Only back
Uh,
pain.
only back pain. Okay. And are you taking any medications?
Yes, doctor. I'm taking this regular codeine for black back pain.
All right. Codeine for back pain. Okay. Okay. And okay. And all right. Do you feel fatigue, tiredness,
No, doctor.
any cold intolerance that others
No,
or
doctor.
all right. Okay. Okay. Mm, any recent surgeries or anything that you have had?
No, doctor. I never went for surgeries.
Okay. And how about your height and weight?
26.
Okay, okay, 26. Okay. And in your family, is there any history of any health like a problem of gut or colon?
No, doctor.
All right. And okay. Um, so all right. So Miss Julie, what do you think it is?
Doctor, I think it is because of my diet and I cannot exercise. That's why I'm getting it.
Sorry, I can't
It's
hear
because
you.
of my diet and diet.
Okay, okay. And what about, do you have any particular worries?
Doctor, I just don't want to have any cancer.
Okay, I understand your concern. And how you want me to help you with it?
Doctor, I want something stronger. Like, uh, can you give me any medication to relieve this?
Okay. So, Miss Julie, yes, I will answer your queries after I gather some more information. Is that okay with you?
Okay, doctor.
Okay, so Miss Julie, you as you're worried about cancer, have you ever done any test for your this heart stool?
No, doctor.
Okay, okay. And how is it impacting your daily life and your daily activities?
Doctor, just it's very difficult for me to go to toilet. I'm afraid to even go because it pains me sometimes.
Okay, okay, I understand your worries. So, Miss Julie, you are here today because you have this heart stool ongoing for last 9 months, and you are worried that it might be a cancer, and you want me to help you with that. Am I right?
Yes, doctor.
Yes. Is there anything else you would like to add?
No, doctor, that's all.
Okay. So, Miss Julie, as you have a long-term ongoing constipation, this is a condition called constipation. Are you aware of it?
No, doctor.
Okay, because it could be you're having a hard stool. It could be you are taking this medication codeine for your pain. So most probably this has caused you this constipation. However, I'm gonna write you some investigation like full blood count, ESR, CRP, and FOBT. How does it sounds to you?
Sure, doctor.
Okay, so. You will do a fecal occult blood test and these blood investigations, and once your result is ready, I will review you in 2 weeks. However, I want you to stop this medication codeine, and as you have also an ongoing back pain, I would like you to take any other medication for that. And also I would also this pain is from quite long time, so how about I arrange another consultation for this back pain? Is that okay with you?
Sure, doctor.
Okay, so for the back pain, I will arrange some more investigations. I will arrange another consultation with you and see if there is anything, and we'll give you investigation. But other than that, for this constipation, now I want you to stop codeine, and I will give you some stool softener. Is that okay with you?
Sure, doctor. So can I stop
Okay.
coding now?
Yes, but not suddenly. You need to taper it gradually, gradually. I will give you a leaflet, and you can
Hmm.
follow that and just stop it gradually rather than just stop it suddenly. How does it sound to you?
Okay, doctor.
Okay, and for your hardening hard stool, I will give you Movicol. You can take 4 sachet today, and then next day you will take 2 more sachet, 6, and then like that you will take 8 sachet for few days until your stool infection is cured, and then you can take a maintenance dose like 2 sachet daily. How is that okay with you?
Okay, doctor.
Okay, I will give you a written instruction how to take it, and also meantime, I would suggest you to take some plenty of fluid and try to drink more water. And also, I'm giving you some smoking cessation leaflet. And for your back pain, I will give you a
Time's
painkiller.
up. Okay. So, doctor, actually complete 10 minutes. That's why I stopped you also. So, nicely done, Dr. Sadia. Now let's discuss about your cases. So, first case was anemia
Anemia,
in
I didn't study that case. Huh? Yeah, yeah.
yeah, anemia in the pregnant, and you did very good job asking the LMP at first. So she was pregnant. This was the hidden agenda in this case. Otherwise, don't need to add a lot. Only that you miss psychosocial. No, no. Yes, you miss psychosocial. And 1 to 2 things like, is it her first pregnancy? Okay. If it's her first, uh, was there any complication in previous pregnancy? Her previous
Mm.
was actually a miscarriage. Okay. So we
Oh,
need to
yes.
ask if it's second, then previous was miscarriage or normal, and her menstrual cycle before the periods. It could be heavier. Okay. Meanwhile, we can ask, is there any bleeding from any parts of the body, like do you get any bleeding in stools? Okay. And
Mm-hmm.
ice was asked. Otherwise, you don't have to add a lot here. You almost done what was needed. You can also add vitamin C in this case. And since the patient doesn't eat red meat or any kind of meat, you can say green leafy vegetables, lentils and beans, and some kind of fortified cereals. Okay, if she doesn't want to have a other diet, just vegetarian, and also vitamin C rich foods with the meals and the medication. And also, if she has any kind of constipation, tell her to have more fluids and fibers and avoid mostly laxative in this case. Okay, because sometimes iron supplementation can cause constipation, so tell her try to take more fluids, try to have more fibers. Okay.
Okay. Okay.
And
And
you are not going to refer this patient for IV infusion right now. We will just start on the medication. And for over 2 to 3 weeks, then you can check the hemoglobin again.
okay,
Okay?
okay. 2 to 4 weeks,
And
right? We can. Mm-hmm.
yeah, yeah, 2 to 4 weeks, like in a month, we can repeat.
Okay, okay.
Okay? And
Yes, I
also
wasn't
tell
sure.
her even it's almost like 2 to 3 months to 2 to 3 weeks to get build up the hemoglobin, and also 3 months after the postpartum we need to recheck for her iron levels. Okay. Anyways, reassure the patient. The next case was just 1 minute, I forgot actually.
Constipation because of codeine.
Constipation. Yes, your next case was constipation. So we can ask in the starting, either this could be because of hypothyroid, either the diet, either medication, either they are not doing any kind of exercise and sedentary lifestyle. Okay, so you almost ask all of this, and here in her case, it was mostly because of medication, and she was having low back pain. You did right thing by sending her into another appointment. And also lower back pain because we can connect her, uh, stop the codeine, taper the codeine, meanwhile start on the other medication like paracetamol along with some topical brufen gels, and connect her to the therapist like physiotherapy. Since it's 1 year long back pain, you can also connect her for therapist as she cannot do any exercises, so some physiotherapy is needed. Until
I
and
was
unless
just
her,
confused because shall we give any imaging because it's 1 year and non-radiating pain.
yeah.
So I was just wondering if I should tell her that do an X-ray or shall I give her again
Yeah,
painkiller?
no, 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 no. Don't give her just manage her pain symptomatically, like medications, and also give her another review. Her cause was sedentary lifestyle. Back pain was mostly because of prolonged sitting. An occupation we need to ask. She was working 12 hours on desk.
Oh yes, I
Okay,
forgot
and
about.
bad posture. So we can tell her about these things. Idea, concerns, impact was asked. In this case, FOBT and other tests are not required. Just
Because she was
symptomatic
worried about
management.
cancer.
Yeah, but if the patient is worried about cancer, we can just say, just ask in her family, does anybody has cancer? Because mostly it's familial. So if there
Oh
was no
yes,
history of family history, okay, so no need to run any blood test over her for her. Reassure her.
okay.
Okay,
So we will tell her
and
that you
also
don't
more
have
fluids.
red flags and any no family history, so no need to do the blood test, right?
Yeah,
The F.
yeah, we can start from the medication, and if your symptoms resolve, then it's basically just your symptomatic management will be given in this case.
Oh, okay, okay.
Okay, you can start on the bulk farming laxative at first is Progola husk, but even if you give Macrogol, it's okay. And if you do examination and you find impacted stools, then definitely you are going to start macro goal. Okay,
Okay.
but if the abdomen is soft and no impaction of stools, then only give the bulk forming laxative first. And tell her to try to go to toilet once in a day. Don't strain herself. Don't no long sitting in the toilet. Try to come out of the toilet within three minutes. Okay,
Okay.
because they are new. Just for your casual, uh, what you can say, casual appointments. Sometimes patients are using their phones in toilets and staying like 10 to 40 seconds, 10 to 40 minutes. That's why they are having more constipation these days. So just in case for your regular appointments. Otherwise, it's 4 to 6 weeks of follow-up. Okay, and keep a check on the red flags. Otherwise, it was good. Okay,
Doctor, what
doctors.
about the dose for macrogo?
Macro goal, as she stated, the starting dose, we will first give the starting dose, and then the loading dose is different than
No,
maintenance
once
for her.
we have to
It's
take
a
the exam.
sachet. We are not going to give any particular dose. We can say that I'm starting you on macro goal with the loading dose. Okay.
Okay,
Then once your constipation is relieved, then I might give you for further few days for the continuity of the treatment, and then I put you on the other bulk laxative if needed. Okay,
sure.
here not particular sometimes if the
Mhm.
BMI is high, then you might change the sachets, but it's just the loading and the maintenance.
Sure. Doctor, can I take you 5 minutes? Actually, I have queries since 2 days, but I am not getting anybody to discuss for. Regarding like
Okay, sure.
in the emergency cases, right? Like patient came with the
Yes,
chest pain, 8 out of 10 with sweating, and you know it is MI. Like yeah,
yes,
means this is one case like acute cholecystitis, acute pancreatitis. When you know it is emergency because they are telling show emergency response. So my question is, once you are going to take patient on the bed and you are telling the patient this is like your cardiac problem. So in that case, where we have to fix the eyes? Means
I
I'm a
okay.
little bit confused regarding.
Okay, patient tells you that I have chest pain. Ask where is it going? How severe
Mm-hmm,
is it? Since when?
mm-hmm,
Okay,
mm-hmm.
you got the idea. It is heart problem. Okay,
Yes.
you will
Mm-hmm.
ask. You will ask, are you comfortable sitting or if you want to lay down? If
Yes, come lay
it's
down. Yes,
MI,
yes.
yeah,
Mm-hmm,
he will prefer to lay down, and you
mm-hmm,
start. You will say that I am activating my staff to do your
mm-hmm,
ECG. Meanwhile, I want to examine you. Is that okay
mm-hmm.
with you,
ECG, yes.
Mr. Ahmad? Yeah, okay.
Mm-hmm,
As soon as you do examination,
mm-hmm,
focus examination, and the ECG
mm-hmm.
is going on, you can ask, Mr. Ahmad, what do you think you are going through? Here you will ask right after the examination.
Okay. Before telling him
Okay?
the exactly what's going on.
Yes, yes.
Actually, I was
Right
little
after
bit
the
confused.
examination.
Once you have done like, I am little bit confused, a little bit worried about that. It seems like it's something serious with heart like this. So when we have to, before telling him exactly what, we have to ask him what you think
Yes,
and what is your
yes.
worries.
We should never tell the patient what he is going through before asking the eyes. So, eyes is always first before telling what is going on with you.
Okay, because I was little because they are telling show the emergency response, and once patient is telling
Yes,
everything is okay, then we have to ask ICE,
yes,
and then we have to reply. You are thinking like that, but actually, I am concerned. It is some heart problem like that.
yes. No, no, no. You can just do the examination, ask. Uh,
Mm-hmm.
uh, Even though you can say as soon as you got the ECG, they might provide you ECG and tell you it's acute MI changes. You are saying
Mm-hmm.
that giving her 300 milligram of aspirin. As soon as you
Mm-hmm.
said it, and meanwhile you ask, Doctor, Mr. Ahmad, what do you think you are going through? Do you have any particular concern? And what
Okay.
do you expect from me? And he tells you
Mm-hmm.
that I feel that is heart problem. Yes, Mr. Khan, is it a heart problem? We call it myocardial infarction. For that, I have to refer you to the emergency.
Mm-hmm.
Okay, and
Mm-hmm.
you have activated your response. You have
So
told the
same
patient,
for
I'm sending.
everything, like acute cholecystitis, pancreatitis,
Yes,
acute abdomen, peritoneal means the
yes,
intestinal obstruction, anything.
yes. Okay.
Okay.
You just
Okay.
do the like in the intestinal obstruction, you will run the X-ray, abdominal X-ray, and meanwhile
Yes.
examination. Then you will ask the eyes. Okay, they
Oh,
might provide you with the findings, and then you
sure.
can explain to the patient, I'm referring
Mhm.
you. Then the patient is stable. You did your emergency response. Now you can continue. Like,
With this,
can
rest
I
of
know
history,
more about your condition? Yeah,
past history
like
and
psychosocial and family histories, etc.
everything, like
Okay.
as we are doing, like, yes, sure. Thank you.
Yes, and you also have to tell him that while I'm referring you to the emergency department, do you have anyone
Yes.
with you? It
What
is
they will
very
do for
important.
me. Yes.
Yes, and also what they will do to you. Okay.
Yes, sure, doctor. Thank you.
Thank you, doctors. Okay, goodbye. Take care, doctors. Tomorrow I'll be sharing the time.
Thank you.